Good afternoon, everyone. Good day. I'm here again. This is your vendor of good news coming to you today with yet another exciting edition of the clinical and cultural adaptation to the United States. And today we have a very interesting personality in our midst. She has been with the Decency NCLEX Academy for, I don't know, for a very long time. I was just telling someone that she's one of the founding members of Decency NCLEX Academy. She's worked with us and now she's living her dream in the United States. She's a nurse practitioner. She's doing her doctorate degree program. She'll be done with it next year. And also, she's doing a very exciting role. She's working at a hospital as a hospitalist. She's a registered nurse, but she's working as a hospitalist and also a clinical instructor in one of the universities, one of the very renowned university in the United States. So you can't beat some of these qualifications that she has attained. And today we are here so that some of these successes that she has, some of the success that she has, can rub off on us. So we are here to contact and experience one of the things that kept her going in her career, made her to be able to get some of these things. And lucky enough, because she's someone who is an erudite scholar, so she has prepared very interesting topic for us to listen to today. I'm just going to give her the opportunity to share those topic with us, share those presentation with us, and once she does that, and at the end of the meeting, we'll have opportunity to ask her question. I know we always do good with all our questions. In fact, one thing that she did today that I love so much is that in her presentation, she also added some ethical dilemmas. So we're going to be, looking at some ethical issues, some ethical concern, not the one that I shared to you, but the one coming from yet another person, so that you see that some of these things will bring to you every Friday are very interesting topic. They are very interesting things that you should be aware of. So I encourage you not to, leave this meeting. I encourage you to let your friends know that we have started this meeting. It's going to be an exciting training, an exciting opportunity for us to learn from someone who has seen it all, someone who has been a registered nurse in the Nigeria for a very long time, someone who has, come to the United States through the same process that you're going through, someone who has been in the United States and pursued her career, she's now, and I would say you are at the top of your career right now. And I don't know how else to give that introduction. She wears so many hats. And for some of you that give excuses, I'm a mother, that's why I'm not doing so much. She's also a mother. I think she recently had a baby and doing all these exploits. So I encourage you, today is a day to draw strength from someone who has seen it all. So I want to welcome you, Ifi Chinedu Ilodianya, to our meeting. How are you doing today? I think you're
Um,
muted. Go ahead, unmute. Sorry. Yeah, go ahead. Yeah.
Thank you so much for the introduction. I'm well. I'm alive and grateful. Thank you.
Ni- Nice, nice. We are so happy to have you today. I know, and I remember those days your days in the academy. Your sessions are always one of the best. Everybody struggled to be in your class and all that. So, bringing you and having you find time for us today is actually a blessing. So, thank you so much for making our time to be in
Oh,
our meeting today. All right. So.
anytime.
All right, thank you so much. So now I'm going to have you share your slide and then we can get into the meeting. As we continue to let people in, I want people who are here to, continue to let your friends know that we have started this meeting. And then one thing that we always do before we start all our meetings is that we try to find out where all our guests are joining us from. So come on, guys. I want you guys to go to the comment section and let us know your state, your country. We have had people from Zimbabwe, Kenya, Ghana, Cameroon. Just rep your country. In any country that you are joining us from, I would like to greet you. I would like to welcome you. I see someone from Saudi Arabia. Yes, you're welcome. Oluchi from Saudi Arabia. I see Yemisi in the UAE. Thank you so much for joining. Christiana Okogun from Lagos, Nigeria. Thank you. Rahila Isa from Nigeria. Thank you all for joining. Keep it coming. And I'm going to give it up, now I'm giving the mic to Ifeoma so that she can continue her presentation. As she's doing that, please kindly pen down. I see someone from Brazil. How is Brazil today? Yes, you're welcome. You're welcome. All right, so just let your friends know that we are here, and then pen down your questions, and we'll take all the questions at the end of our meeting. Thank you so much, Ify, and you can go ahead with your introduction. I would like us to start on a very soft note. Can you give us a little intro? I know I tried, but it is not exhaustive. I didn't go deep into your all the accolades that you had both in Nigeria before you left and the one
Okay.
you have now. So if you can just walk us through, who you were in Nigeria and then when you came and, a little bit of just so we can have a connecting point to your journey. Okay?
Okay, yeah.
Thank you so
Thank you
much. Go
very
ahead.
much. Yeah. So my name is Ifeoma Chinedu. My friends call me Ify, and that's to make it easier for foreigners to also pronounce Ify. My maiden name is Ilo Dianya. So you might not know, I'm still the same person, Ifeoma Ilo Dianya. And that was before I got married and I started answering Ifeoma Chinedu. I had my nursing education at Madonna University at LLA River State with Farede. And after I was done with school, I did my youth service. And after youth service, I went on to pursue my post-basic program in intensive care. I did that at Jos University Teaching Hospital. And after 1 year plus, I had my ICU certification and I started working at FMC Yenigua, Bayelsa State. And I was there working in the ICU until I migrated to the US. So while in Nigeria, I was a registered nurse, a registered midwife, and a registered intensive care nurse with the Nigerian Nursing and Midwifery Council. My journey started in, I think, 2017. Um, 2017, I was just right about to have my baby. They were already like booking me for my CS, cesarean section. Then a friend of mine called me, "Hey, can we talk?" I'm like, "Not really a good time. They're booking me for, CS and all that." She said, "Well, I really wanted to tell you something. There's this agency that came to National Hospital. We met them. They help nurses migrate. They are called Sharewater Health. However, they only take BSc nurses, and that, my friend, was just an associate nursing holder. She's like, since I didn't qualify, I was like, let me call you and tell you to apply. She told me that was a good news, but at a very at I won't call it a wrong time because I was trying to balance another area of my life. She called me the next day. Have you applied? I'm like, well, not really. She kept pushing until I applied. So I applied, Sharewater Health accepted me, and my journey began. Uh, I started the journey with them 2017, took my NCLEX at Philippines, passed, but during the process they had recession and there was a little delay. But to my advantage, I was pregnant and I knew my agency was strict on, pregnancy or coming over pregnant. So I'm like, okay, all things work together for the good of those who love God. So while that recession was on hold, I had my pregnancy journey and I had my second baby. And right after that, I migrated. I came into the US first time in the US was November 2019. Per my agency, you have to come in first, activate your social security, you go back and come back when they're ready for you to start working. So I came in first, November 2019. I was at Miami. And after a while, I had to go back to Nigeria. Then I relocated finally in January 2020. Coming in January 2020, February, there was lockdown, COVID hit. My exciting journey of migrating to the US was mixed with it, there was this ambivalent feeling. I didn't know whether to be excited. I'm like, people have been coming to America and they've been making it. Now I've come and COVID decides to hit and people started dying. It was scary. I would always call home, you know, And I remember what my mom would always say. She said, there are enough graves in Nigeria. If God wanted you dead, he won't let you move over there to die. And, I held on to God. Lo and behold, my unit became the COVID unit. Okay, reality hit me. I knew I was just in this COVID thing for life. So it was rough initially when I came in because of COVID didn't help. There was lockdown, no means for transportation. The kids couldn't go out. Everything was just on lockdown. And it was also challenging for my husband because, they were laying people off jobs. So you trying to apply, you are not even getting anything. So it was really a challenging period for us then, but I focused on, what brought me, and that was just to do my job and do it exceptionally. So I think I listed what my challenges were, but there was this turning point for me. And as much as challenges goes, I had challenges like in my unit where I was working. I was the first agency person to come to my unit. So my unit did not understand when they introduced me in the unit, they thought I was in America. There are people we call travelers. These travelers are paid a lot of money because they have to they are living in two different places and they have double bills to pay. So they pay them more. Of course, you know that there is that envy when everybody knows you're a traveler, you're making more. They tend to dump on you, give you the harder patients. So apparently they thought I was a traveler. They did not understand I was an agency nurse. So it was rough for me. I didn't have people who held me by hands to like walk me through things. No, it was really rough. I learned the hard way. But I was lucky. I had a Nigerian in my unit. We call her US grandma. She's been in this country for over 45 years. So she took her time, showed me certain things I needed to know. And I was just being a fast learner. I kept my eye on the game. I knew what I wanted. But my turning point was during that COVID period. A lot of the people who were oppressing me left. They left to go travel because during the COVID period, people were traveling. There was a lot of money. I couldn't do that. I was on a contract with my agency. So I had to grow up. I had to grow up because I became a charge nurse, like responsibilities and the weight laid on me. So I just had to grow up, learn my onions, and I just became so good. About my academic achievements here, I forgot to mention that while I was in Nigeria, I was a clinical instructor. I was teaching at School of Midwifery, Waterside, Onitsha. And I've always loved tutoring. I love education. And that's why I joined Decency Academy. And I just love to teach. So coming over here, I knew I still wanted to do that. But of course, I had my fears. I'm like, would they even understand me? They're going to say I have an accent. They're going to say this. Like, there's always that thing in you that wants to talk you down. But I shook it off. And thank God my husband, he's my big motivator. He's like, you got to do what you got to do. You have what it takes. And that's one thing I've come to understand. You're always going to meet challenges. But the truth is, when you have something good to offer, you see, everybody's going to complain you have an accent, but so far you are good. They will come to you. So they don't just come to you for nothing. They come to you for what you have. So you just have to be extraordinarily good, to be relevant in this system. So currently, while during the COVID period and while I was with my agency, I went back to school for my master's degree program. I studied at Purdue University, where I got my MSN. I became a nurse practitioner, and I currently still do. I'm a clinical adjunct at Oklahoma Christian University, and that's what I do. Let's talk about the pathways, the career path to acute care hospitalist job. So, apart from being an RN in the US, we have people we call nurse practitioners. Who is a nurse practitioner? A nurse practitioner is a provider. So, everybody is not a doctor. Here, we're used to certain terms back home. We say doctor, doctor, doctor. But here, the people we call doctors are physicians. Now we have physician assistants and we have nurse practitioners. These three group of people make up the people we call providers. They basically take care of, see patients, admit them, take care of them, manage them, either in the hospital or in the clinic setting. So when it comes to the nurse practitioner pathway, like the physician assistants, they go to school, is a master level degree program. They go to school, they come out and they do what they want to do in any specialty they want to do. But for nursing, they have different specialties. So you have to first of all ask yourself, what do I want to do? Yes, I want to be a nurse practitioner, but what is my niche? Initially, when I came over, I was just hearing, oh, psych nurse practitioner, psych nurse practitioner. There is money. There is this one. I think I was attracted to it because they said there is money, but I don't have a flair for it. I don't like psych. For me, it's dull. I like I said, my background is ICU. I like things that make me think, things that keep me on my feet. You know, you're adding things up. You know how the code scenario is, emergency scenario. That's what I like. But I felt like psych was contrary to that. The first school I applied to, I actually applied for psych, and they asked me to write, this statement letter. I couldn't. I was lying and I knew it. I was just saying, I have flair for psych issues. No, I don't have any flair for psych issues. So I just withdrew that application and I had to, go further with what I like. I could care. I like working in a hospital and I just like taking care of you at that moment and the relationship ends. So we have, as far as nurse practitioners go, we have the psych NPs. We have the acute care, which is the part that I told. The acute care, they work in the hospital. We have the family nurse practitioners. The family are the people that are like your primary care doctors. They take care of, all ages, and they do that like just like monitoring you. But if you come to them and you are sick, they're going to refer you to the hospital. We have the pediatric nurse practitioners. We have the people who do the women, and then we have the certified registered nurse anesthetist. So that's the pathway as far as nurse practitioner goes. So you have to find out what you want first, then you go into it. So for acute care, you just have to go to school first. The university you're going to get that master's degree, when you go to now, some universities, when you come in with your BSc, they do BSN to doctorate degree. And when you're done, they give you DNP. Some schools give you BSc to master's degree. When you're done, they give you MSN. The school I attended, my program was to DNP, but you have that freedom that at the end of the master's, you can take your certification exams, do what you want to. And that was the part I told. When we got to the master's phase, when it ended, I took my exams, I got a job. I didn't want to keep going for the doctorate degree till I had a job at least to pay for the doctorate degree. So that was what I did. I took my exams and the rest of it. So when you go to school and you come out, the school, because you passed your courses and you paid for your degree, you're going to be awarded MSN or DNP as the situation implies. Now, when you are done with that, you cannot just go looking for a job as a nurse practitioner. You have to be certified. The certification exam you are taking must be by an accredited body. And when you finish that exam, that is when you'll be awarded what we call AGACMP. I know nurses have a lot of letters behind their names, so I'm trying to explain it so you understand better what it means. This is similar to when you take NCLEX. When you have your associate degree or you have your BSc and you go and take NCLEX. When you take NCLEX, that is a certification exam. You become an RN, okay? Same thing with this at master's level. You have your master's degree, you go take your certification exam, you become an AGACMP. If it was psych, you become PHMNP. If it was pediatric, you become, whatever theirs is. Now, you still cannot work with just your certification. you now have to get licensed. Licensure is done at state levels, and different states board of nursing have different criteria for licensing. So you would now go to your state board of nursing and say, hey, I want to get licensed to practice as a nurse practitioner. Of course, they want to see your master's degree. They want to see the certification exam results you have. When you present those things, they give you the license to practice, and then you become APRN CMP, meaning Advanced Practice Registered Nurse, Certified Nurse Practitioner. That's just what it means. Now, you've gotten all these approvals, you still cannot practice. You have to get what we call DEA. It's just a drug enforcement agency. Now, there are certain drugs you're allowed to prescribe. There are certain ones you're not allowed to prescribe. You have to go through this board to be enforced. Like if you prescribe let's say you have your licensure, you prescribe a medication for someone, they go to pharmacy. They cannot get those medications if your name is not under the DEA. The pharmacist will look you up. So your name needs to be showing under that drug enforcement agency. So you have to get that registered. You have to do what we call OBNDD. This is just a narcotic drug regulation. This is a way they regulate how narcotics are distributed and monitor what we are actually doing. So through this, you are applying for whatever thing. So we have certain categories you can prescribe and what you cannot prescribe. So you go through that as well. Then you get what we call a supervising physician agreement. This is to say, and it's different for different states. Now, over 30 states in the US have independent practice for the nurse practitioner. That means you don't need a supervising physician. But some states still require that. For me, my state just attained that 2 months ago, so we can practice independently now and we don't need a supervising physician. So you need to get all these things. When you now get a job, you still cannot work. And that's what makes it different for a nurse practitioner. Like if you're looking for a job, it's going to take you about 3 months before you start a new job. The hospital will now do what we call credentialing and privileging. This is just done at the stage of the hospital. You've presented your documents, but they have to prove that these documents are true, like they are real and valid. So credentialing means they're going to just investigate you. They will take you back. I remember when my hospital sent me an email and they were like, we haven't heard anything from Madonna. We're waiting on them. I'm like, oh God, good luck. So they're going to dig down to your, wherever you had your, basic education, check your university, make sure everything checks out. When they do all those things, they will even do a background check on you, make sure you don't have any criminal records. After that is done, then they will do what they call privileging. Privileging is just presenting you to the hospital committee, saying we have adopted this one as a provider, and we are going to let her work in this department and in this capacity. Then they will give you privileges, just means what you're allowed to do. So for instance, I went to school, we did intubation, we did chest tube insertion, but because in the hospital, I'm working as a hospitalist, I do not have the privileges to pass a chest tube. So even though I know how to do it, let's say a patient is coding and I'm running that code, I know how to, but I cannot. It's going to be a legal issue for me because I do not have the privileges to do it with this hospital. So your privileges depend on your role. There are nurse practitioners that run our rapid team. They are able to do the intubation. They're able to pass chest tube because they run a rapid team. And in such situations, they encounter, like they're confronted with situations that they can do such things. So privileging is basically what you're allowed to do or not allowed to do in a hospital, depending on your role. Okay. And then you can start working as a nurse practitioner. So that's basically the pathway. So if you want to pursue nurse practitioner when you migrate, first thing, get your master's or doctorate degree. Then you're going to definitely take your certification exam. You get your license with your state board of nursing. You get certifications with the DEA, OB, and DD, and get a supervising agreement if it applies to your state. You get credentialed and have your privileges with the hospital. Then you can start working. So now let's talk about cultural adaptation to the US. The truth is, no matter how much we say this, everyone is gonna like have a different experience. But these are like basic things I feel like anybody who is migrating should know. Let's start with communication nuances. Like communication is a big deal in the US. So eye contact. Basically, for eye contact, when they're talking to you and you're not able to make eye contact, they see that you're not honest. They say that you're not confident, and they say that you're not reliable. So don't be talking to somebody when you migrate and you are like avoiding eye contact. So, and that's why some of them like they look at those things and they're able to make decisions. So let's say you're trying to waste a narcotic. Let's say you lost it or it's spilled, or let's say you lost it in a patient room and you can't find it, and you come out, you're trying to talk to someone, please can you waste this narcotic with me? And they're like, where is it? I don't know, I lost it, I couldn't find it, and you're not even able to make eye contact. The polite way will be, do you mind taking that to the manager? I am not comfortable helping you with that. You're not able to make eye contact. They can't, like, to them, they feel like there may be something shady about this and they don't want to get involved with it. So eye contact matters. I know for us, it is a cultural thing, but you just have to, when you're talking to people, try and make eye contact. Now, humor and sarcasm can always be interpreted differently. Some things you think are funny are really not funny. You know how back home we'll say, you're getting fat, oh. It's sarcasm, it's humor, right? But not in this setting, not in this environment. So please, people interpret things differently, and you must be very mindful of, the comments and statements you make. Then small talk matters. So, let me paint two scenarios. Let's say we were back home in our different countries and somebody walks up to you when you're pregnant, and this is from my experience, and say, oh, when are you having the baby? You might not even want to answer. The person goes again, is it a boy or a girl? Oh, back home, you be like, this one, amiable. She's monitoring me. She's this. You're having a bad interpretation about this. But here, those things, like, it's natural. If you're doing a task with someone, they're definitely gonna just be chipping in one or two things. So expect it. It's not amiable. It's not poke nosing. It's just the environment. Like just ordinary buying coffee from a coffee shop, they're already engaging you. Oh, how old are your kiddos? Oh my God, tell me about it. They try to make conversations. You're going to get it at bedside. You're going to get it in shopping malls. You're going to get it in offices. So don't think anybody is prognosing and the truth is after that, they don't even really care. They've forgotten about what you guys discussed. So don't take it personal, okay? And emails, let's talk about that. So you see, some of us have emails that we've not opened since 10 years ago. Here, you must make a habit of reading your emails daily. If not, you're going to miss out on important, stuff, especially with work. And when you get emails, make sure you are replying. Like communication here, they communicate a lot through emails. So make sure you're checking them. For those of us that have kids, your kids teachers are going to be notifying you through emails. So you just must be checking your emails. Your schoolwork too, you're going to be getting emails from your, faculty members. So checking emails is a big deal here. Don't say, hey, I forgot my password. You cannot forget password here. Check emails at all times. It's not a 1 week thing. I only check my email on Sundays. By Sunday, by the time you're checking it, the thing they called you to come and take would have passed, or you would have missed your appointment, or you would have missed your interview. So make sure you're checking your mails. Then phone calls. Phone calls, I would say, at home, you will call someone, they won't pick. You call again, they will I called him 32 missed calls. Please don't do that here. I'm begging you in the name of God. You call somebody once they don't pick, stop. Drop a message, drop a voice message, please. Just call one time, they're not picking, send a message. When you start calling somebody more than necessary and it's not an emergency, they term it as harassment, please. Then voice messages, that's the thing. When you come over, make sure you set up your voicemail. and check on it too. So sometimes when people call, they'll drop voice messages for you, especially if you're applying for jobs, looking for school opportunities. Make sure you're checking those things. And text messages too. You must be good about texting and replying messages. Another thing is know your channel of communication. One of the things I noticed when I came in here, one of the things I learned from the system is there is a channel for communication. Let's say in your unit, you're having challenges, go to your supervisor or go to the charge nurse. Then, if it's something the charge nurse cannot handle, go to the supervisor. If the supervisor cannot handle it, go to the manager. Like there is a channel, there's a pathway. You see that trend of, but I told Nurse BC told Nurse David now told is turning into gossip. And when they notice you're the one stirring it, you hear, oh, she's toxic. She creates a toxic environment. You become a problem to them, and they don't want problems. So please, you have issues, you want it to be addressed, go through your channel. And it's not the one of I'm got rushing to go and tell manager. And the funny thing is that manager would always ask the supervisor, so they expect you to like go through that chain of command. Now let's talk about cultural sensitivity and diversity. The truth is, we don't want to be termed. Nobody wants to be termed racial, but we also have to give back what we expect. So you don't want people to like racial class you. You also don't do the same to other people. Be open. In America, there are so many people from different places with different backgrounds, different cultures. You're gonna see people who are naked on the streets. You're gonna see people who are clothed and wrapped up in summer like they can't breathe. It is okay. Just look and go. So just know that your colleagues and your patients, they have different backgrounds. So you're going to have those patients that you want to do this, and it's going to look like you're having difficulty taking care of them because, we have different backgrounds. So, and also avoid assumptions about gender roles. You go into somebody's room, you're like, hey, mister. He might be a Mrs. or he might be identifying as a Mrs. So please clarify. And it's okay to say, how would you prefer I address you? And they will tell you what, they want or how they prefer to be addressed. Or you are admitting somebody now, you see that the patient is from a Muslim background and you're ordering their diet, you're already ordering, he could be answering that name, but he didn't even grow up with his parents and he has different preferences. So please always, always ask. Now let's go to professional boundaries. Hugging and physical contact are less common, especially for our male folks. Back home is nothing now. You just see somebody, good morning, you hug, you here, things can, be escalated, especially sometimes I feel very sorry for our male colleagues because things can be misinterpreted. We've had cases of people who just from hugging or just touch, and next thing, they've sued them for harassment. They've lost their job and, all those things. Is your word against theirs. So keep your hands to yourself. That's what I always say. Unless you get to know people better or say, this is my person, that kind of thing. But work environment, just keep your hands to yourself. And it's also very common to call people by their first name. I remember the preceptor I had when I came. She introduced herself to me. She was like, hey, my name is this. She's 60, like 69, very experienced in nursing. I could not get myself to call her name. So I always say, Ma, let me just assume her name is Ruth. So I'll say, Ma Ruth. I did not know that offended her. She was so pissed. And she kept telling people, why is she calling me that? Am I too old? Am I? So our relationship started off very awkward just because I called her Ma, which would have been a nice thing to do back home. I'm very respectful. So since then, I kept my Ma in my pockets. I don't call anybody Ma anymore. Just call you by your first name and move on. And you also don't feel offended by it. You're going to have new graduates who are going to come into your unit. They are 19, they are 20, and they're just going to call you. Hey, Ify, do you want to come check on this patient? Hey, this, hey, that. No, look, don't. So just accept it. Hey, if not for change of environment, I came here at old age. No, 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 no. It's just, to them, it's not even wrong. It's just cultural. Same thing in their schools. My kids will come back and they tell you, hey, Andrew said, I say, who is Andrew? Say, my teacher. I said, don't ever say that. Say, Mr. Andrew, let me know when we're talking about your teacher, okay? Or your classmates. So it's just, they don't even see it as wrong. So you should not even take it to heart, but always check to, confirm people's preferences. Then, as far as professional environment goes, make sure you pay your bills. I will tell you something that happened after I came here. They were like, oh, I'm going to the cafeteria. Do you care for something? I'm like, yeah, maybe some fries. This lady went and got the fries. And I did not know I was supposed to pay because she asked me if I wanted something, right? I'm like, oh, thank you so much. Oh my God, you're so nice. First day passed, second day passed. And she didn't ask me for her money. It was an entirely different person that came. Hey, why haven't you paid Cynthia her money? I'm like, what money? She said the split bill for the DoorDash. I'm like, oh, Jesus, am I supposed to? She didn't tell me I just thought she just did me a favor. Girl, girl. And they don't complete their sentences. Girl, girl. You know, and it was very embarrassing because I am an RN and this person is a CNA. So the expectation is that, oh, you earn more than her and now you ripped her off her, small money. So I had to go pay her and I learned it that way. Same thing, if they like sometimes we'll finish work and you feel like you had a great shift, they'll be like, can we hang out for breakfast? You think it's not free. Oh. If you go there, carry your card, pay your own. Nothing is free. So it's better you offer to pay and somebody will say, I got this, I got this. That's different. But if you don't want to be black labeled, please always pay your bills. So you're gonna see that in units. Hey, I'm about to DoorDash. Do you want to order something? Do you want to just ask them, how do you want me to send it? Is it Zelle? Is it Cash App? Let them now say, oh, it's nothing. I got this. Okay, so just be my, and don't be surprised. Even if it's $1, people pay. After COVID hits, there was no Uber, like there was lockdown. So the people my agency brought us over with, good thing we're all living in the same apartment complex. So we always ride Uber together. From our apartment to the hospital was just $7. And there were like five of us. So if you split $7, it's like, it wasn't even up to $1. But these people held me on my neck to pay that money. So even if it's 1 cent, pay people their money. Just make sure you're paying off things that you owe. Now, let's talk about what culture differences. Punctuality is taken seriously here. There is nothing like an African time. Nothing like that. If work is 7 a.m., you're supposed to be there 6:45. Just know that. There is no excuse. They don't entertain it. Punctuality matters. So always learn to be confident as well. The truth is that we're coming from a different setting or different background, but you have to be confident to gain their trust. Then teamwork matters a lot here. It's not the one of do your own, ma, do my own. You must be ready to help. One good turn deserves another. So if you come in and you just want to be doing your stuff, it's like a cartwheel. It goes round. One day you're going to be so swamped and you won't have anybody to help you. Let's go to navigating homesickness and culture shock. So you're not going to take this one away. You must come to that point. Culture shock, homesickness is real. There are days you're going to question yourself, was this really a good move? Why did I come here? You're going to break down, you'll cry. I don't know if the men cry, but I know they have regrets. You'll be like, why did I even make this move? The culture shock is there, is real. So one thing I would say is build your support system. Build a support system, have people, have friends. It could be back home, it could even be here. Thank God for technology. You're able to make calls, you're able to connect, speak with someone. And that's why it looks like they have high rates of depression in this environment. Depression is real. So encourage good support system. Then be ready for seasons and weather changes. Some of us are used to very hot, like from the tropical area, it's always hot. Here you will see cold and you see it in different dimensions. So be ready, and be weather aware. That's one thing I was never good at. I just dress up and I go out and I never knew they said there will be blizzard at night. Then if I'm coming back, I'll be shaking like this. So you must learn. And sometimes they see you as they look at you like stupid. I've gone to grocery shop one day and I was just wearing, single layer clothes. The way everybody was staring at me, I didn't know it was going to be that cold. Like I didn't know. But here they are always weather aware. Then you don't have an excuse for that too, because especially if you have kids, you send them to school without sweaters, that you're going to be in trouble for that. So we have to really be weather aware. Then learn the healthcare insurance system. It is complex, and we encourage everybody to learn that quickly. Uh, when you come in, you need health insurance. With your health insurance, it has certain privileges, it covers certain things, it does not cover some. So you have to learn it. I had my own fair share of it. I was at work one day and I was just complaining. And one of the ladies said, you better go check it out in the ED. That sounds serious to me. I walked down to the ED thinking it's just ED. I got there, they did ECG, chest x-ray, all those things, everything came back negative, negative, negative. I thought I didn't feel bad though until the bill started coming. You see that small ED that I went to, I paid up to $9,000. Like it literally took me like 6 months pay to pay for those bills. This is something I could have gone to an urgent care. So they have different levels of health care here. We have the primary care, which of course, that one you're not just gonna get it emergently. Like if you call the office, they will tell you to book an appointment. Sometimes it's 2 months away, sometimes it's 1 month away, depending on when they have opening. But if you feel what you want to discuss with a healthcare provider is, urgent and needs attention, we have certain clinics they call urgent care. Those ones are able to attend to you immediately, but it's not as expensive as the ER. Then if you feel like you are really dying, please go to the ER. Okay. So you just have to learn those healthcare system as well is important, especially if you have kids too. So let's talk about practical success tips. I will say mentorship is important, and I'm glad for the people God positioned in my life as far as career goes. So when you have somebody you can look up to, ask questions, and they are, open enough. If you find someone and they are not wanting to share, move on. Nobody is a monopoly of information. Move on to the next person. Like you will meet somebody who will open up their hearts, and it doesn't matter. Sometimes it might be a Caucasian, sometimes it could be an Asian, sometimes it could even be a Mexican. Like you can, like your help can, or your mentor can be from anywhere. Mine is a Ghanaian, and she showed me the pathway. And I'm glad I didn't have to like incur all the student loan people keep doing. I have a friend who came in immediately. She said she was doing masters in public health. I'm like, why don't you wait? You just came in 2 weeks ago. Why don't you wait and find out what you want to do? No, I just want to do this because my friends, I have this. I say, those your friends came in before you. Give yourself time. Give yourself grace. Learn the system. Know what you want and where you want to go into. Of course, she did the public health. She finished. She graduated. Now she just went back to school to do psych MP because she finished. She couldn't find anything to do with that master's. Now this is, unnecessary double student loan. But if you take your time, find a mentor, ask questions, know the right pathway, know what works for you. Don't, you're going to see people doing this, doing that, but ask yourself, what works for me? Different things work for different people. Find out what works for you, but mentorship is very important. No matter the research you do, experience still beats it. So you might have researched it, you feel like, I know this is what I want. But there is a place for mentorship. Is a mentor through their experience that will tell you, this is best done this way, avoid it this way. So let's talk about continuing education. You cannot take it away. You've passed NCLEX, you feel like you've arrived. No, you're going to keep learning. Health care is very dynamic. Things keep changing. Even in our units, 1 minute we're using this kind of catheter. In 2 years, they bring another type of catheter. Things keep changing. So you keep educating yourself and, improving. Self-care. Self-care, we cannot take it away. Like, how can you succeed if you're not taking care of yourself is very important. And oftentimes, because we're struggling to meet up, we neglect ourselves. Self-care cannot be overemphasized. Then learn to speak up. If you're struggling, speak up. Sometimes we hide things and we don't even know that the person that can give you the next suggestion is right beside you. speak up. It could be in the church, it could be at work. Sometimes you just say something and they're able to like tell you, no, you do it this way. Recently, my daughter was given an assignment, a project. They said we should make a diorama. I didn't grow up here. I don't know what that is. So I just asked a colleague at work, I'm like, hey, Keely, do you know what this is about? They said they gave her an animal cheater. We're supposed to make a habitat. Yeah, she said, it's okay, it's nothing. So just go to Hobby Lobby, you buy this, you buy. She was calling the names of those things and I was writing it down. I didn't know what they were, but that was we did it and it was perfect when we finished. So speak up. You could be struggling with, a health situation and somebody will be like, no, go through this. Some states even offer like free healthcare for certain people who don't meet a certain criteria. Speak up. If you don't speak up, you won't get any help. Then let's now move to clinical adaptation. Let's start with scope of practice. Now, nursing practice in US is strictly protocol driven and is based on evidence-based guidelines, not we usually do it this way or we do it that way. And oftentimes protocols change, guidelines change. So you must look at what is obtainable in your facility. Those who have been traveling or have worked in different facilities will tell you. And okay, it's just like after I started my job where I am currently, sometimes if I want to put in an order, I'm like, hey, do you guys do this on the floor? I know where I was working before they do that, but of course, every hospital is different. They have their protocols. So you must always make sure whatever thing you're doing is complying with the protocols of the hospital. And also, Nurse Practice Act, it varies by state, not yours. So some people say, my friend in Texas, she said I should be doing it this way. Is it or you are having problem, they will tell you invoke harbor, invoke your whatever harbor, right of whatever harbor. Somebody's in Texas is the one advising you. Do they do harbor in Oklahoma? No. So certain things you must know what is obtainable in your state. Just know that. Then documentation. This is a big deal. It's not about I did it now. I did it now. Ask this person. No, you must document it. If it's not documented, it's not done. So make sure you're documenting and in real time. Be objective. What do we mean by being objective? You just can't type patient is fine. What is fine? What is fine? It's very vague. You mean patient is alert and oriented, or you mean patient is not in distress, or like what is fine? So be objective when you are, doing your documentation. Then just know that documentation is your legal shield, is everything. A certain case can be brought up 4 years later, 5 years later, you won't even remember the scenario, but your documentation will be remembered. So make sure you're documenting well. Then communication in healthcare. Oftentimes we use not oftentimes, we adopt the SBAR, that's the situation, background assessment, and the recommendation model to communicate in healthcare. And I think a lot of people struggle with that, but that's basically you're calling a provider and you just say, and I see that too. Sometimes some people will page and I call them back. I'm like, yeah, this patient, he's throwing up. Mm-hmm. And you don't hear anything else. What do I do with that information? Oh, this patient, his heart rate is 110. What do you want me to do with that information? I don't know that patient. What brought him in? What's going on with him? You have to give more information. So the best way would be, hey, this patient was admitted earlier today for, maybe for difficult shortness of breath. He has pneumonia. He's been fine, but in the last 10 minutes, his heart rate has skyrocketed. Currently, this. On assessment, he denies any chest pain, he denies any this, he denies any that. And I recommend you give me something for heart rate control. And the provider can say yes or no, or offer something else, but they need more information. And this also tells people how much you know. You know, they are calling you to say something about your patient and you can't even give the basic details. That doesn't make sense. Now, HIPAA is a big thing. Sensitive health information must not be given out to people who don't need to know it. So it's a big deal. You just can't, share patient information with anybody you see. Even with their family members, you need to know, you need to make sure it's okay with the patient to share such information. We must be assertive but respectful. And I think that's one thing we lack from our culture. We, in the name of being respectful, we shy away from asking certain questions. So when I mean being assertive, let's say I put in, okay, and this has happened to me. One time, a patient's potassium level was low. They notified me, hey, potassium 2.9. I'm like, okay, I'll put in some orders. And I put in an order, I went and put in Lokemal. Lokemal is what you give when potassium is high to reduce it. So this nurse calls me back and she says, hey, did you mean to put that Lokemal, or because the potassium is actually 2.9? I'm like, oh, thank you so much. I will change it. That's a mistake on my part. And I changed it. So you should not be afraid to question certain orders if you don't feel comfortable or if you don't think it sits right. But that does not mean you have to be insultive or be rude about it. That's what I mean. Be assertive but respectful. In the long run, you're going to be protecting yourself. Because if something were to go wrong, yes, the provider put in the order, but you administered it. So if something doesn't sit right, if you're concerned about anything, it mustn't even be about order. Let's say a patient doesn't just look right, speak up, be assertive, just be respectful about it. Then mind your tone, gestures, and mannerism. This one was a big one for me because I feel like I'm loud, you know. But here, when you're talking to them and you're loud, they feel attacked. We talk from our background, we talk with hands. Yeah, so, you demonstrate. They're feeling threatened already. So you must mind your tone when you're talking. Don't be too loud, and mind your gestures and mannerisms as well. Then ask questions when unsure. Remember patient safety. Just have that at the back of your mind. Whatever you do, patient safety first. If you're faced with any dilemma, just ask yourself, what is going to keep this patient safe? And you do that. Now, technology, this is a big deal. I know, especially the older ones amongst us. I can't type. Oh, hey, how will I cope with this? So, hey, now every hospital system uses one electronic medical record or not. It's different. This hospital might be using Epic, another hospital might be using Senna, then another one is using Meditech. But of course, they're going to have you go through orientation. You will learn it and you will adapt to it. Your typing skills matter, so make sure you learn how to do that. Now, medication, they use barcode medication administration system. Make sure you're scanning everything at every time. Sometimes we get too busy. I've had situations I thought I could play smart, and thank God the barcode administration system helped me, saved me. Our pixies, they put the stool softeners, you see the 50 milligram, the 100 milligram, they put it like that in the same pack. So I'm like, oh, listen, I picked it. But when I got to the room, I scanned it. It said, this medication is not for this patient. I looked again. I said, it's the medication. Now see the name. I scanned it again. It said, this medication is not for this system. Then I looked closely, I saw I picked 100 milligram instead of a 50 milligram. So always make sure you're scanning your medication. It has saved a lot of people. It keeps saving lives. So I always say scan your medications. And the thing about this environment is that everybody is aware. Even the very, as in the unlike, how back home a lot of us don't even know what diabetes is, don't know what hypertension is. Most of them know their stuff here. They know it, they know their medications. Before, when you're even trying to bring it, they're like, is that mine? You didn't give me my this, you didn't give me my that. Like, they're well informed. So you know your stuff too. And know that you are being watched, please. There are cameras everywhere. Even where there are no cameras, just know that your colleagues are watching you. You are being watched. So act like someone who is being watched. Now let's go to patient-centered care. In this environment, we have what we call a shared decision making. And oftentimes, you don't just impose anything on the patients. We let them make the decisions for themselves. And they have a say, even if you disagree with it. So let's say you come to bring medication for a patient. No, I'm not taking that. No, I don't want that. No, I don't want that antibiotics. I don't want. It's their choice. All you have to do is educate them. And if they're still insisting, you document and you let the doctor know they're refusing, you know. But you can't shove it down their throats. They are adults and they're able to make their decisions. And patient satisfaction scores are always prioritized. So we are just like waiters. You know, you just have to be acting nice. Just waiters in hospital settings, say it like that. We aim to please, and that's what it really is. Now, for job termination, this is what nobody really talks about. I would say don't stick out your neck in any toxic environment. Uh, as much as we pray for everything to go smoothly for everyone, sometimes it doesn't always. But if your environment is toxic and is costing you your peace, you're going into depression, and maybe your license is at stake, please find an exit route. Don't stick out your neck in a toxic environment. And it's always okay to even change units or try another specialty. So let's say your agency brought you in and they put you like, here on a med surg floor and you are struggling. It's not a fit for you. It's okay to ask to be switched to another unit or you apply to go some other place. You can try psych, you can try trauma, you can try oncology, you can try nephrology. And that's the beauty of nursing. And that's what I love about it, especially in this environment. It is vast. It is so vast. If you feel like a hospital is so fast paced for you, we have the LTACs, long term acute care, we have the home health, and we have the nursing homes as well. So, but most importantly, whatever you do, don't burn your bridges. I know why I say that. Don't burn your bridges. I will take you back to when I started. I mentioned about the hospital doing credentialing on you, right? They're going to go through everywhere you say you walked to do your credentialing. So if maybe you had a very bad history at a certain place where you walked or something happened and there's something we call do not return. They put a tag or something on your name, you will not be able to go back there. So just make sure whatever you do, don't burn your bridges. Then always put in your notice according to your facility protocol. Oftentimes for nursing, you have to just give a 2 weeks notice before you leave any job. If you feel you want to leave, do the right thing. Don't just wake up in the morning, they'll be calling you, are you not supposed to be here today? And you'll be like, no, I quit. You quit how? Who did you tell? How did you do the notification? Please just always do the right thing. And know your rights and boundaries too. This is about work-life balance in the US. Now, oftentimes we come with this expectation. If I come, I will pick all the dollars in US. There is actually dollars here, but it doesn't finish, truthfully. You can do, there are opportunities, you will do great, but don't just do what you can within your capability. Now the US labor law protects you through breaks. Every job you must get a break. So it's not like if somebody is stretching you 12-hour shift and you haven't had a break, no, it's illegal. So you have a right to your break. You have a right to time off. So there is no job. If they're telling you keep working, 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 no time off, it's illegal. The US labor law protects everyone against that. So ask for your time off, take time off if you need it. And also the overtime pay. Typically, if somebody works over 40 hours in a week, you're expected to get something extra. So make sure you advocate for yourself. You're in a place where you're not getting such privileges. Speak up, ask questions. Now, we call this PTO. Basically, what we know back home is leave, annual leave. But here they say paid time off is aimed. You just use it to recharge yourself. So you apply, you take off. And don't feel guilty for saying no. Sometimes you might be placed in a facility where they are so short-staffed, and every time they're calling you, can you come in for extra shifts? Can you come in? Can you come in? And you are stretched, you can't handle it, or maybe you have a family engagement, maybe your daughter is having an activity in their school. Don't feel guilty for saying no. I had that guilt syndrome and I felt like, oh, they needed me. You feel like that until you get in trouble, you see they don't really need you. So don't feel guilty. If you have to say no, say no. And you don't even have to give excuses. A lot of times from back home, I'm sorry, I can't come. My father is now in the clinic and you start giving excuses. No, here, no is enough. No is a sentence. Oh, I'm sorry, I can't make it. No, I won't be able to come in. That's enough. Don't start telling them about your ancestors. So let's go to shift management. Make sure you stick to a shift that works for you. Now, oftentimes with night shifts, they pay what we call differentials. So people who work night shifts make a little more than people who work day shifts. So when people migrate recently, of course, we are all motivated with the money. I want to work night. I want to work night, even when you know night is not for you. Even when you know before 5 p.m., you're already nodding. My sister, come out from that night shift. You get yourself in trouble. Because if you're sleeping on duty, some facilities don't take it easy. If you make any mistake because you're so tired and you can't keep awake, is impacting your license and your record too. So please, please, please do what works for you. Some people can never do night shift no matter what you pay them. And some people can never do day shift no matter what you pay them. So just always know that. Then avoid back-to-back night and day shifts. It disrupts your health. You work night today, tomorrow you do day, next tomorrow you do night. You're messing up your body. It disrupts your health. Because the truth is, we work so hard, we do all these things. If you break down just one hospital visit, all that money you've worked for will go out in hospital bills. Then make sure you're planning for your recovery days after overtime. It's okay. Pick up that shift, work it, work it, work it. Then take out time too to also recover from that. You worked hard, you made the money. Take time to also relax and recover. It's very important. Now, self-care is not optional. Make sure you are aiming for at least 7 to 8 hours sleep. Sleep is your biggest booster. Then healthy meals are very important, and make sure you're drinking water even on busy shifts. Here you will see typically everybody carries cup, everybody's carrying bottle. Is I think, let me just say, it's cultural for them. Join them and be carrying it. There's a reason why they carry it. Drink, 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 hydrate yourself, and make sure you're eating healthy. In this environment, people tend to easily fall into unhealthy eating because it's so easy to like grab fries, grab burger, grab this, grab that. Make sure you're eating healthy and you can also make your own meals. Then make sure you go for annual wellness checkup. We see this coming up a lot. I'm healthy, I'm healthy. You're healthy because you've never gone to a doctor. When you go, we'll see if you're actually healthy. Especially if you have insurance, schedule it. It's one time a year, it's free. Your insurance covers it. As far as you don't have any, diseases or anything they're managing you for. So go get checked up, know where you are as far as your health goes. We've had a lot of, immigrants who just slumped at work. Recently, we had one in my workplace. He's from Zimbabwe, and it was just so sad. They did scan and they realized he had like bleeding hemorrhagic stroke, and they had to take him in to start doing like clean up and all those stuff. So please check up. A lot of us don't know what we carry. I've had people who come into this place and the first wellness checkup they went for, they realized they were diabetic with A1C in the 14s. But because we don't do all this preventive wellness checkup back home, we feel we're okay. Nobody just slumps and die. There is an undertone. So please make sure you're making out time for your health. Then make out time for your hobbies. There is a tendency that people tend to lose themselves when they migrate. The environment is fast-paced. Work is busy. It's not the one of nobody pays you to sit down. When you're coming to work, you're coming to work. Like work, you earn the money. That's just the best way to put it. You must earn that money. So you're working hard. There are so many things to do. You're busy, but please make sure you make out times for your hobbies and so you don't just slide into depression or lose yourself. And before you know it, you're like 50, 60, and you look back, you're asking yourself, what did I ever do with time? Recently, some friends of mine were just five. We made our time once every month. We do something for ourselves. No kids, no, just us. And I had the opportunity to do horse riding. I've never done that in my life. It was so exciting. We did like the skydiving. It's exciting. Just go out there, try some things. You work hard, you deserve some enjoyment too. Now, physical activities matter. In this environment, obesity is a big deal. And if you don't take care, the things we put in our mouth are not helping, then most of the jobs are sedentary. Back home, you will carry this, you will carry that, at least you're doing something here. From your garage, you enter car, you drive to shop. And then, like, you're always driving, like, so you're basically not doing any physical activity. So make sure you try to engage yourself in physical activities. You can go to the gym, you can even do short walks, and it also helps to manage your stress. Mental health and emotional wellness is a big thing. Make sure you have support networks, friends, faith communities, professional groups, whatever. I'm proud we have a group of nurses. Most of us came through agencies. It's called EAG. Is for me, I like it because it's cruise for me. I just go there, I laugh, I read some things. I'm like, you know, it's just a way to distress for me. So find friends, go to church, whatever your religion is, associate with your people. And I had Filipino friends. What they always say is find your tribe and make them family. So use your employee assistance program too for counseling if ever needed. Then let's discuss. I've been talking too much. You have been asked to pick up the fourth shift this week, and the extra money is tempting, but you're already physically tired. What factors will you consider before saying yes? Any thoughts? Anyone typing anything?
Hello, everyone. Yes, so this is very, very is so deep, Ify. I just want to say thank you to you. I wanted to stop you in the middle and say let's have you next week because
Oh,
it was too much, and the information were, and then even everyone on the comment section, they were just applauding you, and it's just a lot. And I want to say a very big thank you to you for this presentation. It should have been a two-session or a three-session seminar, but you gave it to us one full balanced diet. That's what I call it. But thank you so much. I
thank
really
you.
appreciate it.
You're
So I
welcome.
saw the questions you asked, guys. We want to do it the decency way. So on the comment section, I want you to give us responses to the question that Ify has asked. And I want it to be very, very, we have almost 60 something people here. So I want it to be very, very interactive this time around. We have been following, and I believe that we have learned a lot from Ify's presentation. So please, kindly give us your responses. Thank you for bringing them in. So if you continue from here, just do what you know how best to do. Thank you so much.
Okay. I see on the comments, Peace asked the question. She said, is MSN same with MP? So MSN is just the degree you have. Somebody can go to school, get a degree, it's just called MSN, but they are not nurse practitioners yet until they take the certification exam and they are licensed by the state. So let's say somebody went to school, got a degree, but have not taken their certification, or they've taken it and they failed. As far as you've not passed and you've not been licensed, you are not a nurse practitioner. You are just a master degree holder, okay? When can you start? Yemisi said, when can you start your MSN on arrival to the US? You can start anytime you want. You can start tomorrow if you want. There are so many schools, you just have to go ahead and apply. But I will advise you take your time, find what you want, know your niche, and also know what schools are open to you. Because certain schools, especially if you wanted to go to the state schools that are local to you, like in your state, and this is a mistake a lot of people make, or information they don't have. When you're going to a school in your state, if you just come in, you're going to be paying high because you're still regarded as out of state candidates. But after 1 year, you become a resident of that state because you've paid taxes for at least 1 year. Now they start charging you as an in-state student. So take your time, research what school, which one is cost effective for you, what is feasible for you as far as your shift goes, because sometimes some people come in today, they've started school tomorrow, and you have a problem with your agency and you have to move out from that state or go somewhere else. I remember the first school I applied to, they told me, oh, sorry, they don't cover Oklahoma. I said, okay. So what if you're in such a school and now you're trying to move to another state where your agency got job for you and your school don't operate in that state? So take your time, make your research, know what you really want. But if you want to come in tomorrow and start tomorrow, you can. As far as you have your RN license, your BSc degree that they will evaluate, you can always start. Okay, thank you. I love that no hospital because in Brazil, I'm tired of having to hug staff. I know, right? Uh, okay. Can you do MSN in any field apart from the field you were employed for? Yes, yes. So I have friends who are actually working like acute care. I had a friend who were both in trauma, were brought in by the same agency, working on the same floor. She was doing psych MP as her master's degree. So there was nothing about psych in my unit. She did it and she completed it. I also have someone who is currently in the ICU and he's doing psych nurse practitioner. So you can always go in any dimension you want. But certain nurse practitioner programs don't, they need a certain experience from you, like the CRNA, the certified registered nurse anesthetic. You must be working in the ICU or must have had ICU experience. So you can't be in psych and say you're coming to do that program. They won't accept you. If I'm not burnt out and healthy. Thank you, Cynthia. Oh, that's my classmate, isn't it? So she's answering the question. She said if she's not burnt out and she's healthy, she can pick up the fourth shift. So that is just, and as far as this discussion goes, I want to say always put yourself first. I'm telling you the truth. You see that job you're looking at, put yourself first, because if you're not there tomorrow, this job will continue. Like they will employ somebody tomorrow. You are not indispensable. So always ask yourself, can I handle this? Can I do this? And before you pick up. Uh, okay, thank you. I will say no and prioritize my health. Thank you, Jane. And Fumilayo says physically tired is no, irrespective of the money involved. Thank you. Ramota said my state of health first, and Opeyemi said my rest time. Yes, I like it that we are able to see it from different dimension. Money is not everything, but money is needed. So if you feel like you need the money, fine. But are you healthy? Are you able to? Because the truth is, even if they called you to come and help, if anything goes wrong in that shift, let's say you made an error, somebody died. It's not, nobody will even say they asked you to come in. No, you will be accountable for it to the last. So always put yourself first. That's the summary for that. Glory Chidiban says, if one has a master's degree in public health, how can the person climb to be a nurse practitioner? So that's like the instance I cited for my friend who just came in and started her program 2 weeks after. You cannot. Master's degree in public health is a different pathway. To become a nurse practitioner, it has to be master's in nursing, okay? How can a peri-op nurse navigate to be an anesthetic nurse? How is peri-op nursing in the States? So peri-op is very lucrative and cool in the US, but if you want to be an anesthetic nurse, it's the same thing I talked about. You have to go to school and they have CRNA schools. It's very competitive, but one of their requirements is that you must have worked in the ICU for at least 2 years. So I would say if you come in, try and see if you can get yourself into the ICU, even if it's as a PRN job, especially if you know you want to go in that route. Get a PRN job in the ICU so that when you are applying, you put it in your CV that you've worked in the ICU, they see it, and it gives you a chance to get a slot in the CRNA school. Another thing that make people stand out for CRNA school is if you get the CCRN, the Critical Care Registered Nurse Certification. This is an exam they take. It's just like when I said I was an ICU nurse in Nigeria. The way we have or perioperative nursing specialty back home, we do it as post-basic courses. That's the way it is here. It's a certification course. If you're able to take the exam, those things give you upper hand during your application to the CRNA school. Is it beneficial to sit for certification like CMS RN as a new immigrant? Yes, yes. So most hospitals with such certification increase your pay. Your pay differs with the regular nurse on the floor. So it's good to do it, and it gives you let's say you want to go to a supervisory or leadership position, it gives you an edge. There's nothing wrong with it, and most hospitals pay for it. Ask. When you take such certification exams, they pay you back. And I'll consider my current health and the negative effects on the care of the patients and okay, good, exactly what we said. So Yemisi said, during looking for a job as MP, will your experience outside US be considered? So outside the US, you were not an MP, right? So they're looking at you as an MP based on what you do as a nurse practitioner. So no, they don't. They just They really don't even look at your experience as a nurse because you were a nurse. You're going to be working as a nurse practitioner. They are different roles, totally different roles. But of course, one experience helps build the other, you know. Like I have physician assistants that I work with, and sometimes they'll come to me and be like, "Hey, I'm trying to do this. What do you think?" They're asking me because they don't even know, what it is because they've never really practiced on the floor. But because I've had that experience, I know how it works. I'm able to like guide them. Do they recognize your master degree in nursing from your home country? Yes, 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 they do. All right, let's move to the next question while other questions are coming in. Uh, Gold said you spoke about medications and their names are kind of different from ours. Will you be given a proper orientation on medications or you learn it? No, honey, nobody will. You'll learn it. Okay? Just learn. And Google is your friend. We have resources. Most hospitals on the MAR, the medical administration record, there is a link for lexicon. So always research. For me, when I started, one thing I did and one thing I always tell my orientees when I'm precepting them is I come early. I already like wrote out or print out the medications I'm giving each patient. While I'm looking at it, if I don't know the name of this drug, I've looked it up, I've tried to find out what it does. Because you don't want to be embarrassed when you go into a patient room. And those were the things that gave me edge when I was working. When you know your stuff, even if people don't like you, they don't have a choice than to like you. So when I go, and already some people can be biased, just by seeing you, uh, what is that? What is that? I won't even let you ask me what is that. Hey, I brought your medications for you. Here you go. This is your Robaxin. It's a muscle relaxant. It's going to help control your pain. Here is your oxycodone, but maybe it's a narcotic, but let me make sure your blood pressure is good before I give it to you. This is this. As I'm talking, I'm explaining what I'm doing. As I'm talking, you want to give a subcut insulin. Hey, I'm going to give you insulin for your blood sugar. Do you mind if we give it in the stomach? Because that's the best site for absorption. And some people will be like, but the other nurse gave it to me in the arm. It's still okay too. But like I said, the tummy is the best site of absorption. If they don't buy mine, it's okay. Let's go to the arm. Like, where was it given last? So that we make sure we're rotating the sites. The things you say, those are the things that will make them know you know what you're doing. So nobody will tell you about those medications. You will learn it. And the truth is, like, when I started on a trauma floor, every day most medications are common because you give it all the time. I look it up today, I don't need to look it up tomorrow, I already know it. I look it up next tomorrow, I don't need to look it up again. So you will do, that's where continuing education comes. You will do your own work. And I always say come on time. Now you're going to see old nurses when things are chill, they will be on their phones or watching movie. That is time for you to start looking up those medications. And that's what I do now as a nurse practitioner. I'm working with people who are like have 37 years experience. And when things are chill, they're doing their knitting or doing, but what do? I got to read up more diseases because I haven't seen enough. Like I haven't seen enough. So you do your homework. For peri-op, do you do a MSN for it or you go to a certification program? Are you are you asking about like a specializing in peri-op as advanced studies or just certification? I don't understand the question if you want to clarify. So we'll be discussing why more questions are coming in. A patient rates pain 8/10, but appears very comfortable. And you will see this one a lot too. Hey, how is your pain right now? They're on the phone laughing. Some of them, you even see them on the video call laughing and they will turn and tell you, yeah, my pain is a 10. It's 10 out of 10. Typically, if we're in Nigeria, my face will tell you I'm not buying that. That I'm not buying that. So, how do you handle pain management in US context? Because you're gonna get that. Typically, back home, we always say, here, so you cannot endure. Endure. This thing is tough for everybody goes through it. Try and endure. You try to like say things in that, but you don't say that in this context. Here, pain is what the patient says. Thank you. And Emmy, that's my classmate and friend. She lives here with me in Oklahoma. Pain is whatever the patient says it is. And Chinoye says the same thing too. Pain is what the patient says it is. So if they say it's a 10, look at the chart. Did they say you should give them something? What did they say you should give them when it's 10? Give it to them and walk away. Keep your subjective feeling to yourself. Pocket it, just put it in your pocket. If you go home, you bring it out and throw in the laundry. But as far as you're in that hospital environment, just pain is what they say it is, and you get it a lot. Don't do face, so just mind your face. If you know your face is like my own, you can't control. Wear face mask, okay? Because they're also watching your facial reaction to see. Next thing they report you to your supervisor and say, she don't believe me. She's treating me with disdain. So yeah, thank you, Choma. Choma says I have to believe the pain report of 8/10, assess further, document both the number and comfort level intervention. I respect their choices and reassess the patient. Choma, you're ready to work in the US. Thank you. Fumilayo says, please, do you have any information about international certified addiction professional? No, I do not, but this is just an area of psych as well. So it's just a certification, remember. And this was one of the things that informed my choices too when I came. I noticed a lot of people were doing certification. I just sat down and talked to myself. You can get all these certifications. It's just going to add letters to your name, but my money is not going to change. If the money is changing, it's just changing by maybe $1, $2, $4. But if I do a master's program, my role will change. If the role changes, of course, the money would also change significantly. And that was what informed my decision. So check well. Do you just want to keep doing certification? That's also fine, but this is a certification program, the International Certified Addiction Professional. And always ask yourself, why am I doing this? What do I want to use it for? If you don't have if you can't answer that question, then don't do it. Till you are able to give yourself answers. Why am I doing this? What am I going to use it for? For me, in my situation, why I chose acute care was that I can get bored when I do something for a long time. Like I'm currently working as a hospitalist, but my goal is in the next 3 years, I move to cardiology. Like in the hospital, there are different departments. By the time I get bored with cardiology, I move to nephrology. I stay there again. I get bored. I move to orthopedics. Like there are different aspects or departments. And that was why I said I didn't want psych initially, because I feel like if I go into psych, it's psych my whole life and I can't do it. So always ask yourself that question. What do I want to do with this? What do I want to achieve in the long run? I am actually wondering how NP works. Do they stay at home and consult as doctors or in their facility? So GSERTs, so how they work depends on the facility and the role they function in. So we have NPs who are in specialty like cardiology, nephrology, dialysis, urology, different departments. We have NPs who work in the clinics, like I explained earlier. We have the ones that work in urgent care. They come there, you complain of cough, they do this, give you antibiotics, you go. We have NPs who work from home. Those ones, we call them remote. They're like remote opportunities. Yes, there are those ones. Like my facility has a sister hospital. I cover them remotely. So they paid you, you just call them and you whatever they need, you go into the computer and you put in the orders. That's remote monitoring. So they rotate us that we also like do the in-hospital and we do that remote covering as well. So it all depends on the facility, what your preferences are, and which area you want to pursue. But yes, NPs do. They can work from home and they do the same things doctors do. Exactly the same things doctors do. There are still the ones who do surgery. We call them the first assist. That's another area of nurse practitioners. So they do everything and they're good. Rams, I don't understand what you mean by value plus. So Oluchi says, is there a specialty transition program for nurses in US health facility, especially transitioning from med-surg to CV ICU? So no, basically what they have is orientation and you have preceptors to guide you. When you're transitioning from one program, from one department to another, they're going to give you orientation and you're going to have a preceptor. So that's basically what you get. So let's go to the next let's discuss point. You are invited, while we're waiting for more questions to come in, you are invited to a potluck. What are some of the things you can do before time to avoid embarrassing yourself? Have we ever heard of what a potluck is? Well, you're going to hear it here. So potluck is just when they're organizing something. It could be in a unit, it could be in the church, it could be any gathering, and they say we're having a potluck. It means everybody brings something and everybody will just eat together. So bring what you have. So some of the things you can do before time to avoid embarrassing yourself is to ask. I had a very close friend. She was a CNA, but she was so close to me that I could ask her even the minutest embarrassing things. Because I had embarrassing moments too when I started. I remember one day one of my patients was like, thanking, going bad. And I just told, I saw someone, can you get this for me in the corridor? I said, corridor, right? They went outside and they were like, I'm like, hey, can you help me, please? Said, what really are you talking about? I said, it's out there in the corridor. Another person that came in and said, you mean the hallway? And all of them started laughing at me. It was embarrassing, but it's okay. I moved on. So since then, even my kids do it to me. I'll be like, get that carton, bring out that carton. They say, Mommy, you mean the boxes? I'm like, okay, yes, the boxes. So you're gonna hear different things. I would always say plaster. I remember the day I was looking for plaster in the hospital. I said, please, have anyone seen the plaster? They were all looking at me like I felt stupid. What are you actually looking for? I said, plaster. I put it in my phone. I showed them the picture, plaster. Oh, you mean the band-aid? And they started laughing. So there's always going to be that embarrassing moment, but if you're not sure of anything, always ask. For instance, your neighbor had a baby, ask, when is a good time to come see you? And don't go to people's house, under cultural. Don't go to people's house if they don't invite you. Notify them, tell them you're coming. Let them tell you it's okay before you go. You don't go. Don't just go knocking at people's door. You'll be hearing somebody was shot dead, somebody was shot. Don't go and be knocking at please be safe. So if you don't want to be embarrassed in such gatherings, especially in professional setting, ask questions. I always ask, like whenever they want to plan something, so I don't go and bring swallow and soup. So I'm like, what would you like me to get for you? Somebody's planning something. What would you like me to bring? How would you like me to help? There is no shame in it. Next one. A patient refuses care due to cultural bias. What is your professional response? And it's okay. Some people will just see you and not like you. Just expect it. Oh, you have not even said your name. You have not even introduced yourself. They just don't like you. So, what is going to be your professional response? Oh, thank you, Annie. Oh, okay, Rams. Thank you. I got it. Oh, answers, please. Patient has the right to refuse care. Okay. Yes. Thank you, Amy. So they have a right to refuse their care, just like we talked about communication channel, take it to your supervisor. Hey, this nurse is refusing care from me, and they will switch you, they will handle it. Leave it, let them handle it. If somebody said they don't want you, let it go. I don't even struggle for someone to have me because sometimes you finish struggling, something will go wrong in that shift. They don't want you, they don't want you, let it go. As far as it's not because you did something wrong or because you made a mistake. You don't, it's okay. Let it go. Don't drag it, don't stretch it. And uh-oh, I think that's the last question we have. I don't know what's wrong with my screen. I'm sorry about that.
Yeah. So
I
is
think
that
that's the
all?
last question on my screen. Yeah, the last one
Okay.
should be question. Oh, no, no, no. Okay. So just to close, yep. Just to close, I don't know if you guys are still seeing the screen. Are you?
No, you can share it again.
Okay. I don't know. It's making me resign in again. But just to close, I can just go orally. Just know that you are coming to US with a solid foundation of resilience and resourcefulness. That's what I like immigrants about. I was just talking to one of my doctors yesterday. He's an immigrant too. He was like, I go anywhere the money is. And we started laughing. Immigrants are strong. We carry resilience with us. We carry resourcefulness. So you're already at advantage. Like you are already at an advantage. I hate to see immigrants mess up here because I'm like, Jesus, you don't know what you carry. We are resilient, we are resourceful. Now, coming to this environment, the US is going to give you the tools, the structure, and the opportunities. All you need is to merge both together. And when you merge it, you'll be unstoppable. So please don't ever look down upon yourself. Everything is possible and there are opportunities here. All you have to find out is you just have to find out what is for you. Then just always know that adaptation is a process. Give yourself time. The first 6 months will feel very overwhelming, but just know that it gets easier. It's going to feel very overwhelming, but know that it gets easier, especially if you have kids. You're trying to adjust at work. You're trying for your kids to adjust. Your husband is trying to get a job. He's trying to adjust. Sometimes it feels so chaotic. You don't know if you want to be available for your kids to help them learn and understand. Like, it's going to be very overwhelming. You're going to learn taxes too. Let's not even go there. That one is overwhelming. When I started with my agency, they said they'll be paying me 25 per hour. While back home in Nigeria, I was so excited. I'm like, okay, now 40 hours a week. I calculated, I say 40 by 25. I say, that's good money now. I even told my husband, we don't make 40 by 25. I was so happy. I said, okay, in 2 weeks, it's about 2,000. So I was like, oh, good. Then the first paycheck I got, I think by my calculation, I was expecting maybe 2,300. I got 1,500. I started calling my agency. My money is not complete, oh. My money is not complete, oh. And they were like, what do you mean? Because, sometimes the way we even talk about things is not the appropriate way to present it. I'm like, my pay. They mean, oh, you mean there's a discrepancy in your paycheck? I'm like, yes, that's what I mean. They were like, okay, let's walk through it. So your gross is, I hate that word, gross. Gross is, and then the net is, I said, how now? So when you take out health insurance, federal taxes, state taxes, social security, Medicare, Medicaid, 401k retirement, that was my first American wonder. I'm like, God, how do I cope with 1,500? Just you're looking at your rent is 1,100. You're not talking about car bill. You're not talking. That was when I told myself, like, I felt cold. I said, Chai, all my people I promised at home that I will make their life better. How do I fulfill my promise? So it's a process. Give yourself time. And if you've promised anybody you're changing their life, tell them now you will change, but it will take time. We'll go back. Change what you told them. Oh, I'm telling you true. Go now. Just go back and tell them, I'm sorry. You see that thing I told you, eh? Let's wait and see what we will do. So keep your promises. Just stay open. And finally, what I would just say is give yourself some grace when you make mistakes. You're gonna make mistakes. Pick yourself up and keep moving. Sometimes I've had to, you have to like buy something and somebody else will say, hey, I went to a body cheaper. You feel guilty. Shake it off. We all cannot get it right. Sometimes you will do it this way. Another person will say, if you knew, you would have done this. When I had my baby, I was just ending my contract with my agency, and the hospital I was supposed to start with, you must like work 30 days before insurance kicks in. So I had my baby C-section, very expensive, without insurance. And then it was after 3 months, I met someone that said, no, now you would have gone here in Oklahoma. If you go here and do this and do that, it would have been free. Yes, as in that day I cried. I don't know if it's postpartum depression or so. You are gonna make mistakes, but please give yourself grace. Adaptation is a process. Ask questions, pick yourself up, and keep running. Thank you.
Awesome, guys. This is so you are so real with this topic. Like you brought it home to us. I know many people in the comment section are already feeling like they are already in the US. This is amazing. So, guys, one thing, if you really got value for this presentation, I want you to write value plus 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 on the comment section. Please go to the comment section and write value plus 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 however times that you got value. I want to see values on the comment section. This is one of the most interesting sessions that we have had. You are just, you touched on every area, and this is one good thing I like about your presentation. Like I said, it's a balanced diet. You gave it to us hot and real. And I like how you presented everything. This is amazing. This is so amazing. I want to say a very big thank you to you, Ify. You did great to this topic. I would have loved it to even be like a 2-session seminar, like I said before, because this is exhausting. We went all through it, and I felt like the thing that you're giving them, they will be tired by now. Let us share it and give them later. But we're able to make it to the end. So come on, I see a lot of values on the comment section. Thank you so much. Thank you, Ify, for this wonderful presentation. I really appreciate you. And there's one more thing that we do whenever we have this kind of presentation. Every Friday, we come here, we get a guest that come to talk to us. Majority of our listeners, people who are here, they come from different countries, and they are all on different stages of their US journey. So, but because they come from different countries, we have them do like a greeting in their dialect, like in their home country language. They're going to say thank you to you in their home country language. Okay, so we have people from UAE, we have Saudi Arabia. We want to see how they say thank you. And every other country, even those in Nigeria, Nigeria has a lot of languages. So however you want to present yours, I want to see all those thank yous in different languages, because we don't pay our guests on this show. We don't pay if he's doing this as a payback, as a community, just something like a charity thing that she's doing just to pay back to the people back home, just people that are still following her. She's trying to like give back to the community that she came from. And I really appreciate her for doing that. I gave her a call, just one touch. She didn't say no. She just said, let me see if it works with my calendar. And she checked and she was like, okay, let's do it this Friday. And it was a perfect one. I just want to say thank you to you. So I'm not seeing those thank yous in different languages. Or is my comment section full? Okay, it's not full. Okay. All right. So let's see. Let's see how many languages we have here. So we have the first one. The first one is Madase from Ghana, that's Rams. Madase, thank you so much. Yeah, thank you. Song Song 8080, Akwa Ibom. Shukran from Saudi Arabia. And then we have Dalu. Dalu So, one. That should be Nigerian Igbo, okay? So, and then we have Imela Nos Ifi. We have Dalu So, Nne. Chukwu Gozie Gị, we have Dalurinne, we have Modupe Lowo. This should be Yoruba. Is it Yoruba or Hausa now? I don't know. So, and then I have Adupe, that's Yoruba. We have Dalu, we have Adupe, we have Seyabonga from South Africa. Yay, Mimi, thank you. We have somebody from South Africa. Madase again from Ghana. And then we have Madase again from another person in Ghana. And then we have Dalunwa Nyoma Chukwugoziegi from somewhere in Igbo language. I think that's Igbo language. So have someone say hello, thank you, Decency, for this session. I have an idea. Can we also have couples session? Because most spouses don't seem to understand this journey. They promise their relative like like once they get to US, all their problem will be solved. Please do consider. Okay, we'll consider to have a couple session. There's actually been on my there's a lot of languages here. Someone in Benin said in Benin City said Uwese. Thank you so much, peace. And then we have Ahizigi. I don't know what that language is. I don't know what that is, but it should be a greeting. Okay, we have someone. Yeah, complete those. Eshun Popo, Eshun Popo, something like that. Then I don't want to bite my tongue. There's a lot of Mboko, Zuru, Kebbi State, Nigeria. Oh my God, there's a lot of people on this show and a lot of languages. We want to say thank you. Thank you. If it's just our own way of appreciating our guests when they come here. We speak many languages who come from different countries, but we are all on the same journey. And the goal is that people become successful when they come here. So thank you, Ife. It was a great moment having you on this show. Thank you, and thank you. I can't thank you enough. You're needed. You're needed. Yeah. So I can't thank you enough for this wonderful presentation. Thank you so much. God bless you. If you really missed part of this,
Lizzie said she asked a question that has not been answered. Lizzie, can you repeat?
can you repeat the question?
Lizzie and Presh said their questions have not been answered yet.
Okay, so if you missed any part of this presentation, In the next 3 hours, you should be on our YouTube channel. So you go to YouTube and you'll be able to see this presentation. You can listen to it. It is actually packed. I'm going to boost it because a lot of people needs to hear what went on this. And then, yeah, our admin has just posted the link. Just click on it, subscribe, so that once I post the video, you'll be able to get notification that a video has been posted, and then you can listen to it from the beginning. Okay, so just click
Okay.
on and then
So
follow on.
Lizzie asked her question again. She said, you are to care for a patient and the person refuses. What would you do? You simply just report to your next in command. So you have a charge nurse. A charge nurse is like the person running the shift. Go to her. Hey, this patient is refusing care. That's all you have to do. They know what to do. They either switch you out with another nurse, give you another patient, or if it's a supervisor that is in charge of the shift, just go to them. There is no need, don't engage the patient. What I typically would say when I enter your room and I notice that is, okay, I'll let my charge nurse know, okay? Or I'll let my supervisor know. You close the door, walk out, go tell them they make the changes. No drama, no too much talk. Then, Presh, for peri-op specialization, do you need an MSN or a certification program? So it depends on the capacity of what you want to do. Like peri-op, a lot of there's a friend I have that is a first assist for surgery just because she has a peri-op background. What you have to do is still a nurse practitioner program. You do nurse practitioner, but there's the one they call first assist. You will now do a certification for first assist. That way you continue in that role that you guys do in the peri-op department. But I know that there is still a certification program they do, but you do that certification program, you are still a nurse, you're not a provider. So those are two different roles, okay?
Yeah, the name of the certification program is CNOR, CNOR, Certificate Nurse Operating Room. So if you want to go that part, like if it's just going to be a $1 difference on your paycheck, okay? But if you go to other specialties, like if you become a nurse practitioner or you go to First Assist, if you want to be a registered nurse First Assist, you do that program, that'll be a little bump on your paycheck more than you would get if you did a certification course. All right. So yeah, so I have posted the YouTube link. If you want to hear or see the presentation, you can see that on the comment section. Just subscribe to it, and then from there we would post it in the next 3 hours, and you'll be able to listen to it. All right, yeah, we posted it again. You can go there and see it. So we cannot take all the questions. Fresh, you just give us a lot of questions today. We will not be able to do all the questions. And it's so I don't want to kind of overwhelm our guests today. We have actually taken so much of our time. The plan was the program will be 1 hour, and then we have spent almost close to 2 hours here. And I just don't want us to kind of, keep on, lingering this whole topic. So, but, like we said, we appreciate her. If you were asking, this is a favor we're going to ask you, that when next we call you back to come and give us this very, very power-packed presentation again, that you would be able to, afford us that luxury or luxury of your time. I know it's not, to us, it's a privilege, but to you, I know is a sacrifice. So I know if we ask you for this favor, I'm just pleading that you'll be able to give us that opportunity to come back on this show and give us some of these very interesting topics and hot topics that we need to know about. Thank you so much, Ife, and God bless
Thank
you.
you,
All right.
sir.
So we're
Anytime.
all right, thank you. We're gradually coming to the end of this show. Okay, so now we are doing something. We are trying to do a kind of a mentorship program, for people, because we've been having a lot of medical dilemmas and ethical dilemmas that people have been getting involved in because they don't know what to do. They come to the US, they don't know. Like the last time that somebody called me, I was in distress, someone that just got to the US because she went to the gas station and then decided to pump gas and pump diesel into the car that is supposed to be using PMS. You understand? And started the car and was moving, and the car just stopped moving along the way. So the whole system was jacked up, and this person had to actually, file insurance claim. Insurance rejected it. Was a whole lot. So we want to start preventing some of these things by, launching a program for mentorship. Like people that want to be on this show, we're still, trying to put together all the topics, but there's going to be very interesting topics like this: pumping, how to pump gas in the US, driving in the US, so many things that you need to know about the US, insurance in the US, everything. We're putting it together now, and then we have a WhatsApp group that we're going to, post on all our platforms. If you are already you cannot be in that group if you have not gotten to at least CC. You need to be case complete before you be on that group, because we want to give you information that is relevant to you. We don't want to give you information that you will not be able to use in the next 6 months. We want it to be something that you get into it and get the information, come here in the US and start making use of the information, instead of having to linger for a year and then you would have forgotten that information over time. So I want us, to just be on the lookout. Once that WhatsApp group is shared, join the group, and then we'll start from there. There's going to be weekly lectures on different topics that you need to know about. And then you're also having that interaction with a one-on-one mentor. Somebody's going to put you through, or someone you can actually call and say, hey, I'm at the gas station. Which one should I press? Which one should I do? And the person will be able to help you. These are things we do, not paid services. Nobody is paying for this. It's actually out of our love for people and out of the desire to see people succeed on this journey. All right, so look out for that. And then if you look on the comment section, you will see most of our links, most of our classes. You see the resumption dates and everything. If you are still on the verge of getting your NCLEX done, please look up some of those things. If it's IELTS, also look up some of the flyers that we've shared. You will be able to join IELTS, PTE, NCLEX classes. And then if you have written your NCLEX already and you're not in the EPG, let us know and we can add you to the EPG group. All right, so I think we've come to the end of the show. Thank you so much for joining, everybody. I appreciate you guys. We've taken so much time today. I promised you guys that we're going to do a little bit of immigration question today, but we won't be able to do it today. We'll push it to next week. So next week, at the end of our presentation, we'll be able to take some question on immigration, okay? All right, so thank you and God bless you. I think if Chinedu has tried to answer your question, Lizzie. So everybody is happy today. Rams, thank you so much. God bless you. Thank you, Annie, Eka. Thank you, everyone. If I didn't call your name, just know that I'm saying thank you. Yes. Okogun, yes, I see you. Thank you so much and God bless you. Thank you all for joining. Join us next week. I don't want us to start this show every day with less than 50 people. So join us next week. At a point, we're close to 80 on this group. I want us to be at least 50 every time that we start. So join us next week so that we can start and then have everybody join from from the onset. All right. God bless you and God bless you and God bless you. Hi, everyone.